Hi everyone. Welcome back. Heart disease remains the leading cause of death for older adults, but here's what makes it especially tricky. Many of the earliest warning signs don't look like the dramatic chest-clutching moment we see in movies. They're subtle, they build gradually, and they're incredibly easy to write off as just getting older. In this video, we're covering the early signs of heart disease that seniors most often overlook or dismiss, and just as importantly, when a symptom means it's time to call your doctor versus when it means it's time to call emergency services. Let's get into it. In younger adults, heart disease symptoms tend to be more textbook. Sudden, severe chest pain being the most well-known example. But in older adults, symptoms are often less dramatic and more gradual, for a few reasons. Aging can affect how pain and other sensations are perceived, which means some seniors experience less intense or even absent chest pain during a cardiac event. Something doctors sometimes call a silent presentation. Other health conditions, like arthritis or diabetes, can also mask or mimic heart-related symptoms, making it harder to know what's actually going on. And because many of these symptoms, fatigue, reduced stamina, occasional dizziness, overlap with normal aging, they're often dismissed rather than checked out. This is exactly why it's worth knowing what these early, subtler signs actually look like. One of the most commonly overlooked signs is a gradual decline in energy or stamina. Finding that everyday activities, like climbing stairs or carrying groceries, feel more tiring than they used to. This happens because as the heart becomes less efficient at pumping blood, the body doesn't get the oxygen and nutrients it needs as effectively, leading to a persistent sense of tiredness. The key thing to watch for is a change from your normal baseline. If something that used to feel easy now consistently feels difficult, that's worth mentioning to your doctor, rather than assuming it's simply a normal part of aging. Shortness of breath, especially during activities that didn't used to cause it. Walking a short distance, going up a flight of stairs, or even lying flat, can be an early sign of heart-related issues, including heart failure. Some people notice they need to prop themselves up with extra pillows at night to breathe comfortably, which can be a specific sign worth mentioning to a doctor. As with fatigue, the key is noticing a change from what's normal for you, rather than assuming any breathlessness is simply related to aging or being out of shape. Swelling, particularly in the lower legs, ankles, or feet, can be a sign that the heart isn't pumping blood as efficiently as it should, leading to fluid buildup in the body. This is sometimes called edema, and while it can have other causes too, new or worsening swelling, especially if it's accompanied by weight gain over a short period, or swelling in the abdomen, is worth bringing up with a doctor. A simple way to check is pressing gently on the swollen area. If it leaves an indentation that takes a moment to bounce back, that's worth mentioning specifically. A heartbeat that feels irregular, unusually fast, fluttering, or like it's skipping a beat can be a sign of an arrhythmia. A heart rhythm problem that becomes more common with age. Many people describe this as feeling their heart flip-flop or race for no clear reason. While occasional brief palpitations can sometimes be harmless, especially related to caffeine or stress, frequent or prolonged episodes are worth having evaluated, since some arrhythmias, like atrial fibrillation, carry an increased risk of stroke if left unaddressed. Occasional dizziness, especially when standing up quickly, can have many causes, but frequent or unexplained dizziness, lightheadedness, or even fainting spells can sometimes point to heart-related issues, including problems with heart rhythm or blood flow. This is another symptom that's easy to attribute to aging, dehydration, or medication side effects, and sometimes it is exactly that. But because the potential causes range from minor to serious, recurring episodes are worth discussing with a doctor rather than dismissing. Waking up suddenly feeling short of breath, or experiencing loud snoring alongside pauses in breathing during sleep, can be linked to sleep apnea, a condition that's closely connected to heart disease risk, including irregular heart rhythms and high blood pressure. If a partner or family member has mentioned noticing breathing pauses during your sleep, or if you frequently wake up gasping for air, it's worth bringing up with your doctor, since treating sleep apnea can also have meaningful benefits for heart health. This one surprises a lot of people. Heart-related symptoms don't always show up as chest pain. Nausea, indigestion, or a feeling of pressure in the upper abdomen can sometimes be a sign of heart problems, particularly in women and older adults, and are sometimes mistaken for a digestive issue. Similarly, pain or discomfort in the jaw, neck, back, or arms, without any chest pain at all, can occasionally be a sign of a cardiac issue. This is sometimes called an atypical presentation, and it's one of the reasons heart problems can be missed or delayed in diagnosis, especially in older adults. It's important to draw a clear line here between symptoms that warrant a doctor's visit and symptoms that warrant immediate emergency care. Call emergency services right away if you or someone else experiences sudden chest pain or pressure, especially lasting more than a few minutes, sudden shortness of breath, pain spreading to the arm, jaw, neck, or back combined with any of the above, sudden dizziness, fainting, or a rapid, irregular heartbeat combined with chest discomfort, or sudden confusion, cold sweat, or nausea alongside chest discomfort. These combinations can indicate a heart attack in progress, and time matters enormously for treatment outcomes. It's always better to seek emergency care and be wrong than to wait and be right too late. For the more gradual symptoms we've covered, fatigue, mild swelling, occasional palpitations, these generally warrant a conversation with your doctor rather than an emergency room visit, but shouldn't be ignored or put off indefinitely either. So those are the early, often overlooked signs of heart disease that seniors can easily dismiss as normal aging: fatigue, shortness of breath, swelling, irregular heartbeat, dizziness, sleep changes, and even digestive or jaw discomfort. The most important takeaway here is simple. Pay attention to changes from your normal baseline, and don't assume something is just aging without checking. Regular checkups, honest conversations with your doctor about any new or worsening symptoms, and knowing the signs of a true cardiac emergency can genuinely make the difference between catching something early and missing a critical window. Thanks so much for watching. If this was helpful, give it a like, subscribe for more senior health education, and I'll see you in the next video.